me start first talking a little bit about what type of diseases we can treat with regenerative medicine. I believe for the 21st century, this will be crucial to introduce more kind of natural way of treatment, just because chronic diseases represent about 90% of all diseases that we have to deal with. And conventional therapy typically is not able to cure them. It only minimize or decrease the symptoms of or medical problems related to a particular disease. We include the concept of stem cell therapy in our regenerative medicine practice about 10 years ago. And we really believe, and we have clinical experience, that it represents a new potential to cure chronic diseases, especially when we combine with active patient involvement. So patient must understand what he should or she should eat or he should drink, for example. We also need to introduce the patient to active exercise, and also the mindset is very important. Typically, the patients are coming with a lot of stress, a lot of fear, and so on. So we really need to make sure that the patient understands the situation and what he's able to do actively for himself or herself. Now, what is a stem cell and how we can get it? So there are two main characteristics of stem cells. So it's the cell is capable to self-renew, and also the cell is able to differentiate into a specialized cell in the body. Now, the sources of stem cells can be embryonic or fetal, but for clinical use, we are only using adult stem cells. And historically, the typical sources of stem cells is bone marrow and fat or adipose tissue. We know from like 1950s, 1960s, those were first human trials and for first human use of bone marrow stem cells, mainly for the capability of hematopoietic stem cell supply. More recently, people were showing that mesenchymal stem cells are critical for tissue regeneration and tissue repair. And adipose tissue would be a much bigger source in comparison to bone marrow, just because the yield of mesenchymal stem cells is typically 500 times or maybe even 1,000 times higher in comparison to bone marrow. There might be other tissues which can be used for isolation of mesenchymal stem cells, but typically it requires a cell culture, so there might be a potential risk of contamination or potential risk of some genetical changes when we culture stem cells in vitro. At our clinic, we are only use mesenchymal stem cells derived from adipose tissue. So most of my talk will be devoted to that part. Now, the concept of stem cell therapy to treat chronic diseases is basically if we have any medical problem which is related to some tissue damage. Typically, there is more degenerative changes and more inflammation in comparison to tissue regeneration. So basically, the damaged tissue is not able to perform enough tissue regeneration, and thus we suffer from tissue damage. And this might be related to stem cell insufficiency in that part of the body or in that organ. So we believe that the stem cell therapy concept, when we bring stem cells into the area of the body where the stem cells is insufficient, we bring the body to a stem cell homeostasis and at least bring into the balance the tissue regeneration in comparison to degenerative changes or maybe some inflammation. Now, there are many chronic diseases, and they are typically closely related to chronic inflammation. So definitely we know about effects of chronic stress on tissue damage and oxidative stress inside the cells. We also know about toxins in our environment, in our food, water. And we were actually taught at the medical school many years ago that there is also a role of genetic predisposition. Now I would see the role of genetics in like 5 to 10% in tissue damage and in chronic diseases. So it used to be quite exaggerated that the genetic predisposition is the leader factor for, let's say, chronic inflammation and chronic diseases. We might also see that the tissue damage and oxidative stress is leading to chronic inflammation, and there is close relationship to cardiovascular diseases, to neurodegenerative diseases, obviously to cancer, and also to musculoskeletal autoimmune diseases, and also allergic disorders like asthma or chronic rhinitis. There are many clinical studies already published using mesenchymal stem cells. Also, they are rather not randomized, but based on clinical experience and clinical use in smaller trials, or just individual uses of these mesenchymal stem cells. And today I will be talking about our experience in some neurological diseases. Also, I will be talking about stroke treatment using stem cells, and also we'll be talking about lung diseases. And our largest experience would be with treatment of osteoarthritis and associated problems with musculoskeletal system. Definitely, we can use stem cells or mesenchymal stem cells in other subjects like ophthalmology, like for treatment of autoimmune diseases, or gastroenterology, or nephrology and urology.